myself. I'm very delighted to introduce Karen Turner, Senior Improvement Advisor for the Royal Free Hospital. Her role involves supporting and leading site-wide improvement projects and ensuring that learning is spread and shared. Karen has worked at the Royal Free for 18 years, 17 of those as a physiotherapist, specialising in oncology and palliative care. Karen headed up the oncology therapy team, which works both at the Royal Free site and also the Marie Curie Hospice. She joins us this evening to tell us about What Matters to You, a global movement to improve patient experience and outcomes. She has spearheaded the adoption of What Matters to You at the Royal Free with hugely impressive results for patients and staff. Karen would like you to know that the presentation you're about to see includes real examples of patient stories, but she's not using their real names in the interests of patient confidentiality. Karen, over to you.
Thank you. Thank you so much, John, and for your kind introduction. And hello, everyone. And I'm here to talk to you about something that has had a really profound impact on me. It's changed the way I interacted with patients when I was a clinician, and it also influences much of what I do in my current role as an improvement advisor. And I'm not here to talk about some groundbreaking research or innovation, but I am here to talk to you about 4 simple words. And when they're put together, they make a very powerful question. What matters to you? And I believe if we really want to put patients first and build a happy workforce, we need to be asking this question. So I'm going to take you on a whistle-stop tour of the past 4 years since I heard about what matters to you. And I'm going to attempt to show you some of the impact that I've seen of asking, listening, and doing what matters for both staff and patients. But this really isn't about me. Over the next 30 minutes, I'm going to share some stories from people I've met along the way. I'm going to share stories from Ali, Emma, Michael, Alicia, and David, to name but a few. It's their stories that have convinced me of the importance of asking what matters to you. But before we start, I'm going to ask you to think about that question and think about what matters to you. Now, there are obviously different depths you can take the question. For me, what matters to me now is that the tech works, that you don't regret tuning in, that I can demonstrate some of the partnerships between the Royal Free and the charity, and that no one walks in and interrupts me. It matters so much that no one walks in and interrupts me, particularly a child walking in, that I have stayed at work tonight, as I did a virtual talk a few months ago. And even though my family knew, it really mattered to me that I wasn't disturbed. When I was about halfway through, I heard the door behind me open and my 12-year-old come in and start crawling around the floor giggling. And I was pretty furious, but it transpired she just couldn't wait to tell me that she'd been put in the top set for maths. She handed me a little piece of paper telling me all about it and how excited she was. She then popped up her head and gave a wave to everyone watching and left. And if you look, you can find evidence of that on Twitter. So I didn't want to repeat that tonight, but it does illustrate quite nicely that different things matter to different people. So what you've heard matters to me right now. What matters obviously changes depending on the context. So when I go to the shops to buy something to eat, I try and find something that's healthy, not too complicated to cook, and it isn't too expensive. But when I'm in a rush, what matters is how I can throw something in the oven that I care less about cost. But when I go with my youngest, she doesn't care about any of those things. What matters to her is that food is sustainable, from a sustainable source, and the packaging is recyclable. So if different things can matter so much when we go into the supermarket, how much more when we see a healthcare professional? So I'd like you to think about the last time you saw someone medical. Maybe it's for you, maybe you accompanied someone else, maybe it was for your vaccine. But what mattered to you about it and that interaction? And I'm curious to know if anyone connected with you about what really mattered to you. I hope they did. I wasn't very well a few years ago. Went to my GP, had some investigations, and discovered I fortunately had something that was benign and operable. But there was a really long wait to see the surgeon. And in that time, my symptoms were impacting me to the point on some days I was finding it difficult to work. I had a walking holiday coming up in about 3 months' time. And I remember thinking that if I can't have the operation before I have my go on holiday, then I have to cancel my holiday. And I really didn't want to do that. So when I eventually saw the consultant and sat down and he said to me, "Hello, my name is," and I thought, wow, this is a really good start. And then he said, "I know exactly what you need." And I thought to myself, how has he found out about the fact I need surgery before my walking holiday? But of course, he hadn't. He didn't know what I needed. He just knew what surgery I needed, but not any more than that. It turns out he couldn't fit me in for 4 months, but I helplessly sat there, even as a healthcare professional who should have been able to be more forthcoming. But I wasn't able to tell him that I needed to go somewhere else to have the operation quicker. I just sat there, nodded, agreed to more tests, pre-admission clinic, surgery date, and more, all because I hadn't felt empowered to say what really mattered to me. And that's despite me being a healthcare professional. And that situation made me think a lot about how many times this sort of thing must happen, and what a waste it is too. I left knowing that I'd need to cancel the extra tests, the pre-admission appointment, the operation date, all the things that had been booked. And we could have saved much time and energy and resources if he'd only asked me, and if only I was able to say what mattered to me. I know it's a really small and insignificant example, but I'm sure I'm not alone, and it's made me even more convinced it's a really vital question to ask. So let me take you back to 2017. 4 years ago, pre-COVID, and sometimes my brain struggles to go that far back these days, but in 2017, I was working really part-time. I was working 2 days a week as a physiotherapist. I had young children, and 3 things happened to me simultaneously. So if we could have the first slide, please. I was given the amazing opportunity to be in a Florence Nightingale scholarship. So it's basically a leadership training for nurses. And 2 things the scholarship challenged you to do was to take opportunities that you would normally probably have let pass you by, and also carry out a project that demonstrated you'd done something to improve patient experience. The second thing was the Institute for Healthcare Improvement, which I'll refer to this talk as the IHI. They had a conference that happened that year, and it was in London. And I took the opportunity, something probably I would not have done had I not been on the scholarship, to ask to attend the IHI conference that was in London. They had 1 ticket that was going spare for therapies at the Royal Free, and the charity had funded lots of people to go. And so I asked and was fortunately given this golden ticket, I call it. So you can see here in this picture, there's a whole load of us who were fortunate enough to go to this event that was funded by the charity. And at the same time, I was learning about quality improvement, and you'll see here the model for improvement. It's basically the method that we use to go about improving something. I was learning about it because as an organisation, we had partnered with the IHI and they were teaching us about it. I also was learning about it on the Florence Nightingale Scholarship as well. And it made a lot of sense to me. And I was someone who'd done loads of projects in the past, but wasn't really sure if any of them had really made a difference or not. Now, it was at this IHI conference, I was sitting, remember, among about 3,000 other people, that I heard a lady called Maureen Bisinyago talk about the What Matters to You movement. Now, she'd first come across this question when she'd read it in an article in the New England Journal. And the article was written by Susan Edgman-Leverton and Michael Barry. And the article was all about patient-centered care. And the article says, basically, if we really want to do patient-centered care, we mustn't only ask patients, what's the matter with you, but we should ask, what matters to you? Now, she had talked about this at an earlier conference in 2014 and had already done a call to action. And healthcare professionals around the world, led by countries, particularly Norway and Scotland, had taken this and had created an international What Matters to You Day to raise awareness of the importance of this question. Now, the International What Matters to You Day was 5 weeks from the conference date. And so when James Mountford, who was our then Director of Quality Improvement, who I'd only just met at the conference, asked us at the end of the time that we'd been there, and we had a little sort of huddle, what our take-home ideas were. I summoned the courage, along with another colleague, I think, Bernadette, and we suggested, why don't we take this question that we've heard about, what matters to you, and why don't we have a What Matters to You Day? And we did. And I worked with Bernadette, who was in the therapy services at Barnet, and I was in the Royal Free Therapy Services. And we had a plan. We asked every therapist to ask one patient what mattered to them. And we asked them to record it. And crucially, and I'm really pleased we did this, we asked them to record what happened and how they felt about what they'd learned. So if you could move to the next slide, please, you can see some pictures and some examples of our What Matters to You days. We've actually had 5 now, but these are some of the things that we've done. And these have all been events that have been funded by the charity. And these are all events to try and increase the awareness of the What Matters to You conversation. So on that day, our first What Matters to You Day, in therapies, we had 200 conversations that were had. And we learnt so much. And the next slide shows you all the different things that we learnt. These were different things that patients said mattered to them. And some things you could have guessed, like things like getting home, smiling staff, clean ward, pain relief. But crucially, what we learnt from the therapist is that they couldn't guess what mattered to the patient. and we heard time and time again, they wouldn't have known what mattered had they not asked. The vast majority of staff asking learnt something new. Now, much of that information they gained that day needed to be shared with others in the MDT, the multidisciplinary team meeting. It was so important that learning needed to be discussed, and 80% of the staff who'd asked what matters needed to share that information. They felt that was really important to share. We learned on that day that when you ask what matters, care changes. Staff said that they did something different as a result of asking what matters to you, 66% of the time. Now, that might have been something as simple as maybe walking outside in the corridor, or something more complex, like changing someone's discharge destination. Only asking what matters on its own could also be tricky. So staff adapted and asked maybe what matters to you today, or what's important to you? How can I support you, or what's worrying you? Or even what would I be surprised to know? So these are questions that people use to get patients to open up and have a conversation. It also had an impact on staff asking this question, and the next slide shows how staff felt about asking what matters to you question. 90% of staff said it enhanced their conversation. And so you can see how what staff said, and these are some of the comments from staff after our first What Matters to You Day, and you can read these here. And I think what happened is people realised the importance of asking what matters and how it connected them to the work they were doing. So I think from then, that after that first day, I think I was hooked. I changed my scholarship project to be a quality improvement project looking at the hospice in which I worked. And the next slide shows that our aim was that every inpatient, we had 2 wards, would be offered a What Matters to You conversation every week that was fed into the weekly team meeting for discussion and action. So we started small. We had one conversation with one patient and brought what we'd learnt and what mattered to them into the team meeting. And by the next week, we had 3 patients. And there was definitely an appetite within the team to have this really priceless information about every patient shared. Now, I remember sitting in an MDT meeting a few weeks into the project, and I was listening to conversations that had been sparked from the What Matters to You forms that we'd used. And at the end, I asked how these forms were going and what people thought of the information they were learning. Now, one registrar spoke up and said, they're very useful, but he said, what happens is we discuss our patients in the normal way, and then we hear all this information at the end, all this information that really matters to the patients, and we have to just rediscuss them in light of what we've heard. Can we please present this data that we have, this information, this valuable information we have about the patients at the beginning, please? So after that, instead of patients being presented as Mr. Shah is a 74-year-old man with metastatic prostate cancer, which has spread to his bones, and he's on X amount of this or that medication, or he's struggling with this or that. What is now presented is Ali, because that's what we know what he'd like to be called, is a 74-year-old man. What matters to him is being able to go outside when he gets home to sit in the garden with his dog. Then the discussion happens around what really matters to Ali and being able to see if doing what matters is possible for him. Same sort of information is discussed, it's just framed very differently. Now, the next slide shows some of the things that we learned in the early days that mattered to patients. We couldn't have guessed some of these things that mattered to people. One that really struck me was one in the bottom left-hand corner. There's a gentleman and he said, I know I'm dying, but when I die, I don't want you to tell my wife over the phone. Please let her know face to face. Now, we didn't know that, and we wouldn't have known had we not asked. So the team called a family meeting and they organised how that could happen. And then when he died, the wife was not told over the phone. That really mattered, and it really mattered to him, and it really mattered to his family. So the hospice really took this project on, and it's still going on. And patients are still offered What Matters to You conversations that are discussed in the MDT. And I think it's really transformed the care that's been given. Okay, we can take the slides down for a moment. Thank you. So back to the Rule 3. Now, I will admit that it has been much harder. There's a lot of good practice going on around the Rule 3, and many staff are asking these types of questions, but it's not widespread, and that data shows us that our current assessments don't really capture what really matters to someone all the time. Now, What Matters to You days are great, and they're great fun, but we know the important impact of this question, and we really need to challenge ourselves about why we're not asking it regularly. Now, there is a lot of nervousness about it. People are worried about what happens if someone says something you can't do anything about, or will it take up too much time? And I think sometimes what happens is, as healthcare professionals, and I include myself here, is that we can sometimes do what matters to us at these times. Now, the vast majority of these times, we have valid and understandable things that matter to us. Maybe we want to finish a clinic on time, or attend to the next person who we know has been waiting for ages. We need to go and answer a call bell for a patient maybe we suspect is in pain. I recently spoke to a friend, let's call her Emma, after a recent hospital admission. And most of the care she received, she said, was excellent. But she did tell me that time after time, when she really needed something or really wanted to ask someone something, staff on the ward would walk away when she was about to ask them. She couldn't move, she wasn't well enough to follow them. They had the power, and they were probably going to do something really important, like look after another patient or answer a call bell or do the drug round. But like my daughter, who made a guest appearance at my presentation, she had the power. Other people have the power. The door wasn't locked for my daughter, and there will be patients who are bold enough to make their wishes known, to be able to say what really matters to them, similar to my daughter. But there are many, many more who don't have the power or the permission to have what matters to them heard and acted upon. So how do we give them time and space and the permission they need to say what really matters to them? I met a gentleman called Michael over Christmas a few years ago. I just met him, and he had lung cancer. He was really, really unwell. And I asked him what mattered to him. He was due to go home to his brothers for end-of-life care. But he said what mattered most to him, that he didn't want to die there. He felt he'd be a burden on his brother. Now, Michael's options for discharge, I remember, were limited. Yeah, they were really limited. And I remember there weren't lots of options for him. But I do remember him telling me about his life. He didn't want to go and die at his brother's. He didn't want to be a burden because he'd been a free spirit and traveled around the world all of his life. And having this conversation gave me the opportunity for him to tell me about his travels, tell me the place he'd been, the people he'd met, and how fiercely independent he'd been, and how he'd never relied on anyone. And he didn't want to rely on someone in the same way in death either. I found that with what matters to you, sometimes really just listening is enough. Listening can be an intervention in itself. He died a few days later, but he was in hospital, which is where he wanted to be. But it's not where any of us would have guessed he wanted had we not asked him what mattered. I remember meeting Alicia after her reconstructive surgery for breast cancer. I was a physio and she was having trouble lifting her arm. And when I saw her in clinic, she pointed out that she had a fat necrosis on her wall. And it's a complication after surgery, but tends to go away on its own. And it's not something we normally worry about. Her normal therapist was on holiday, and I can tell she was really disappointed to see me. And whatever I tried, I couldn't connect with her at all. She wanted to see Anne, this other therapist. And it wouldn't have helped her if I told her that I'd trained Anne. Whatever I tried, I couldn't get her to take part in the therapy session. And I left the appointment feeling really deflated. I spoke to a colleague back in the office, and she challenged me and she said, "Did you ask her what mattered?" And I remember looking pretty sheepish and saying, no. So next time I saw Alicia, she'd obviously not practiced her exercises. And then I asked her, "What matters to you?" And she told me about this fat necrosis, this lump, and her anxieties about it spreading if she moved her arm. And suddenly I understood. And I could reassure her, and I could tell her all about the fact that she would do no harm by moving her arm. And we suddenly connected, and she was able to engage in her physio exercises. Now, she was still very pleased to have Anne back from holiday, but at least I knew what her barriers to movement were, and I addressed some of her concerns. And her arm movement was definitely better. Now, my journey with What Matters to You was continuing, and in the end of 2017, I trained to become a quality improvement coach. Basically, it means you're assigned to support a quality improvement project. and try and give them a steer in the right direction using quality improvement methodology. I was halfway through my training and I was assigned a project looking at trying to reduce the nursing turnover in the Royal Free and the Barnet intensive care units, which was very, very high. At Royal Free, I think it was about 48%. Now, when I found out about the project, I was pretty terrified. This team consisted of some very, very senior people. And when I attended my first meeting, I don't think I'd ever been surrounded in a room by more heads of or more directors in my life. I had massive imposter syndrome, I seem to remember. Now, NHS Elect had already been in and focus groups had already been run. And they had already been asking staff about their experiences of working in intensive care. They'd asked them what was going well, wasn't going so well, and improvement ideas. They basically asked staff, what matters to you? At the same time, I just read there was a join work white paper from the IHI, which talks about happy and healthy workforce and how to achieve it. Basically asking staff what matters to you and not just asking, but listening and doing what matters. So the next slide, please. So the idea of join work projects, which you'll see on the next slide, is you ask what matters. You identify pebbles in people's shoes, and then you get leadership support and buy-in, and you use the model for improvement to try and make some changes in the department. So the themes that came up from the focus groups fitted in really well with the themes of the white paper. So we converted the project into a join work project. We had essentially asked staff what mattered and what the pebbles in their shoes were, and we had huge senior support with Rebecca Longmate, and we were had absolutely amazing and engaged matrons who listened and did what mattered too. Now, there were many changes that were made. Staff had said it mattered to have choice and autonomy over their shifts. They wanted to choose when to come to work. So we introduced electronic self-roster. It was on paper before, and we changed the whole system. Well, not me, but some very clever people in the organisation did. They said they wanted more time with matrons. So coffee catch-ups were scheduled in. They said they wanted better rest areas, so that was organised. So many improvements were done by so many people. And in the next slide, you can see what happened to turnover. It's actually a little lower than that today because the matrons there are still asking staff what matters. So having seen the power of the what matters to you question for patients, I now saw its value for staff too. And the next year we did a what matters to you day focusing on what matters to staff. The Royal Free then started their own join work collaboration. So the next slide shows that we've had about 12 teams across the group that focused on staff wellbeing, and we learnt a lot in this time as well, and we learnt what really matters to staff. And often the things that matter, things like teamwork, feeling appreciated and valued, time to come together, clarity of roles, knowing what's expected, equipment to do the jobs, and opportunities to improve. But what also came up is that staff really wanted to improve patient experience. No one comes to healthcare to do a bad job for patients. So closely linked to staff wellbeing is providing really excellent patient care. Now, by the time I took this role as an IA improvement advisor at the end of 2019, I was by now totally convinced that if we focused on teams and services as an organisation on what mattered most, we really weren't going to go far wrong. Now, sadly, COVID halted our join work programme, but of the teams who were taking part, we have really strong anecdotal evidence that they felt that it helped them focus during COVID on the well-being of their staff in a way they wouldn't really have done before. And when COVID came, all the projects I was getting acquainted with in my new role stopped, and I wondered what I should do. And I have to say, I did ask myself whether what matters to you and join work was still relevant. You can see on the next slide. I brought my uniform back to work and was poised to go back and support my clinical colleagues, but we were a bit short of PPE at the time, and we still had enough, but we were a bit short, so I wasn't needed straight away. So I did a few shifts on the newly set up incident room, and I wasn't very good at it, but I do remember being this quickly, and I don't really know how it happened, becoming the person who coordinated donations into the trust. Lots of things mattered to staff at that time. And the next slide you can see, particularly having the right PPE to keep safe, knowing which treatment options to use, having clinical and managerial support. But one thing that mattered to staff was having easier access to food on the shift. Now, the Trust were also setting up free food in the canteen. But in the incident room, we were having calls of people who were trying to donate all sorts of food, including a group of restaurant owners who would later be known as Feed NHS. So I somehow took on the role of sort of donation coordinator in the early days before the charity later took this on. And I became known as the hot food lady. And I'd collect donated food from out the back of the hospital and wheel it around the hospital with a few others and hand it out to staff. Now, and what was being donated varied. And I remember speaking to one nurse and asking her what mattered to her. And she said, look, some of this food is great, but what really matters to me is getting fresh fruit and vegetables, because it was almost impossible to get to the supermarket at the end of a shift and being any food left. And she wasn't alone. And you may remember in the news that there were NHS workers not being able to get supplies after work. So in the next slide, you'll see a picture of our ICU nurses. And what we'd done is we'd found some fruit and veg and we delivered it to the unit. And you can see the look on their faces. They were just so delighted. There was one lady there, one nurse who just basically got this massive broccoli and just ate it. She hadn't seen fruit and veg for about 10 days. And that was all great. But after a week of really, really, really long days, I took a step back and thought, although it really mattered, it wasn't really sustainable and probably not that hygienic either, me like wheeling hot food around the hospital. So very quickly, the idea of this sort of food hub was discussed. And I was getting calls from people saying things like, we have 5,000 socks to donate or 1,000 bottles of water. And we had the need in the hospital, but we didn't have anywhere to store it. So at this point, I'd not really met anyone in the charity, but the idea of the rec club, which is right next to the hospital owned by the charity, was used as maybe a food or donation hub. So I picked up the phone and spoke to Richard, who was the then CEO of the hospital, of the charity, and I explained what we were keen to explore, and he said he'd been thinking along the same lines. So I remember visiting the rec the next day and met Kelly, and who runs the rec, and about 7 days later, I think it was exactly 7 days, we opened Free at the Free, which is the next slide, which turned out to be probably the largest, well, it was, I think, the largest free hospital supermarket in the UK, possibly the world. We opened 6:30 in the morning till 10 and 6:30 in the morning till 10 at night. We ran 7 days a week, distributing donations equitably for all Royal Free staff. And we also had the charity paid for drivers to take the food and donations to the other sites as well. So we took donations from the community, companies, charities, schools, and then we had top-up provisions that were provided via the Royal Free catering route, but paid for by the charity. And we had fruit and veg, because we knew it mattered, delivered every day. So it was run by amazing Kelly and her rec team. And you can see here, there's a picture of some of the amazing 30 dedicated volunteers who supported the supermarket. Now, staff who'd previously left work at 8 o'clock in the evening, really tired and exhausted, tried to get food at the supermarket to find the shelves bare, just turned up, picked up 6 items to take home. Or staff at the end of a night shift turned up in the morning to take food so they could rest when they got home. We had staff in the first few days that literally cry when they walk through the doors, really scarred faces from wearing the tight PPE. And when I asked them what mattered about the supermarket, they said lots of different things. One lady said, I take the love I feel from this place and what is going on here, and I can pass it on to the patients I look after. Someone else said, it allows me to rest when I go home, so I can come to work more refreshed. Someone else said, you have such random things here. I love picking my 6 things. And when I go back home and I see my 5-year-old, who I'm not really seeing very much anymore at the moment, he opens the bag and he gets so excited to see what I have. Someone else said, for them, it wasn't really about the food. It was feeling that their organisation really cared for them. And that would not have been possible in any way, shape or form without the charity. I'm not sure I've met one person whose life has been better because of COVID, and staff in those early days were really terrified. And I asked them a few questions about what mattered, and the biggest issue was probably catching COVID or giving it to their families. People didn't know what to do when they got home. Did they kiss their kids? Did they sleep in the same bed as their partner? Was it even safe to go home to their vulnerable relative they lived with? Probably not. The life of everyone seemed to have been, at best, more complicated, at worst, incredibly distressing. So many staff and families had families overseas who were unwell and couldn't get to be with them, or had partners who'd lost their jobs, and yet were coming to work every day to face this virus, which at that time we knew very, very little about, and many were very scared of. And this supermarket was just something that made life just that little bit easier. So I guess this really reinforced for me the importance of asking staff what matters to you. And if you'd have asked me, and I'm fortunate people did ask me, I'd have said two things. One, doing something that makes a difference for my friends and colleagues who are on the front line, a little something to take the burden away from them. But I would have also told you about my daughter, who at the time we were running the supermarket developed severe agoraphobia. What mattered to me was getting home to her and trying to gently coax her out of her room, down the stairs, out the front door, sometimes even to just sit on the front doorstep without running back inside. And if it was a very good day, we might manage a few meters along the pavement, but we didn't have very many of them. What mattered was I did a good job, but I was also there for my family, and that was hard. And no one at work could really help with that, but knowing people cared what mattered to me helped me to carry on. Now, the supermarket ran for 8 weeks, and we had on average about 1,000 staff a day, and in total 50,000 visits from staff. It was an amazing collaboration between the Royal Free and the charity, and it will stay with me for the rest of my life. Asking on a micro level is important, but it's also useful to ask the question when designing services. So back to my normal job, there's a slide here about our therapy partners, and this is a group of patients who we used to meet in person every 8 weeks to give input into quality improvement projects. You can see here people face to face. Now this obviously had to be stopped due to COVID, but we were really rapidly redesigning and adapting services here at the Royal Free, and we really needed to know what would matter to patients about the changes being made. So we contacted the therapy partners and asked them if they would meet virtually. And during the first wave, we met every week. They gave their input into projects from bereavement services to online appointments, new exercise videos, information for families on intensive care that went out onto the internet. They represented what matters to patients at a wider service level. Now, we have met, I guess, 40 times in this past year, and every clinician who comes and talks to the patients about their change of service leaves thinking differently, really, about the work they're doing and why and how it matters to patients. Now, no one expected, I don't think, the second surge to be as big as it was. I certainly didn't. Now, what mattered changed. There was plenty of food in supermarkets. We didn't need another free at the free. And I was redeployed again, but this time thinking about what mattered to patients. Now, visiting on the wards, as you all know, stopped, although some patients were allowed to visit under our compassionate visiting policy. We had very many more unwell patients in the hospital than we normally would have done. And when we asked patients what mattered, a large majority said being in contact with their loved ones. I remember my first week as a virtual visitor. I was someone who was facilitating calls between patients and the people that really mattered to them. I remember really clearly, I walked onto a ward in the morning. I had 2 nurses come up to me and they told me about David, whose wife had recently died of COVID, and it was her memorial service that evening at 7 o'clock. What mattered to him more than anything else was being there on Zoom, but the iPad on the ward wasn't working, and they also couldn't get the link to the service. So I took the iPad and I took it to IT, and it took about 2 hours to get fixed. And I spoke to David's son at least twice on the phone. He was really pleased we were helping his dad. I got the link set up on the iPad, and we put it on a stand that the charity had purchased for us so that we could have the iPad without a member of staff holding it. Now, the staff on the ward were aware they had to sign in early, as there was only 100 people capacity. And I told another one of the virtual visitors who was in the hospital, and she was the only one that night, that it was all in hand. She didn't have to worry about it. Now, I remember so clearly sitting on my sofa at home about 8 o'clock that night when I got the text. And she said, this lady was in our virtual visiting team, said she'd gone up to check just after 7 o'clock when she'd finished all her other patients, and it hadn't been set up. Something must have happened on the ward. And by the time she got there, 100 people were already in the service, and she couldn't get him access. I just sat on my sofa and cried. We really knew what mattered to him, and we hadn't managed to do it. And it really, really mattered. And I called the son the next day. He didn't answer, but I left a message saying how sorry I was and that really we should have done better. And I just apologised. I helped Steve Evans then lead the team, and over the next few weeks we helped facilitate calls between families and patients virtually. And the next slide, slide 15, over the course of the next 3 months, we had an army of 100 staff who were partly redeployed because many services were kept running on a smaller scale, and we facilitated over thousands of calls. We did all we could. We did all we could. I had that memory of what happened that night in my mind to make sure that we had enough virtual visitors on the ward so that we could do what really mattered for patients. And we had an aim that every patient who needed support with virtual visiting would get it 4 times a week. But because of all we'd done with staff wellbeing, we also wanted the team to, who were redeployed, to feel really part of the team and to have a really good staff experience. We wanted to do what mattered for them. So we ran quite a huge quality improvement project and did many changes to impact redeployment of people who've been redeployed into our team. This included sort of regular psychological support, daily check-ins, inductions, buddy systems. And when people went back to the roles, you'll see on the next slide, this is some of the things they said about the team. We'd learnt that after the first wave, only about 50% of staff had a really positive experience of being redeployed, and we really wanted to improve on that. And we also knew that after the first wave, the team was disbanded, and these calls didn't really happen except for in a couple of areas that were really championing it. So what we did was, and we knew that our 100 staff would go back to the normal roles. And actually at the moment, 99 of them have. We've still got 1 remaining who still helps us out. But in the early days, we realised that we needed to get some support. So we contacted Jenny Todd, who head of volunteering, who we got to know well through our supermarket days, and talked about the possibility of some of her volunteers taking on a training in a new role. And so now we have amazing 7 volunteers who become virtual visitors, and they cover the wards and support patients who are not able to call their families. And this is just an amazing testament to the work the charity does. Now, in the past few weeks, we've had What Matters to You days for staff. We realised we had this, someone had turned COVID malaise, and we were trying to do something that was really nice for staff. So we did a What Matters to You day for staff, where we recognised the kindness and compassion. And there's a slide here where you can see the exec team walking around handing out certificates for staff who had been nominated by other members of staff for their compassion and kindness. So not just what they did, but how they did it. And the next slide is our What Matters to You day we've just had a couple of weeks ago, that the charity again have sponsored and enabled it to happen. And this was our What Matters to Patient Day, again trying to encourage people to have What Matters to You conversations. And that's on the next slide. So the future, I think, really of recording a What Matters to You conversation, in my opinion, lies with digital innovation. And I'm working with the digital innovation team at the moment right now to build something that could be really transformative for patients, and where they're asked maybe before appointment or at admission what matters, and then that is fed into the right people. So slide 19 is just a brief example of what it might look like. So we're building this and hopefully testing it in certain areas. And now there's nothing else like this in the UK that we know of. So I think this could be really exciting, and the Royal Free could lead the way. Because I really, really believe what matters to you is a powerful question that needs to be asked for staff and patients, and at an organisation level as well. It all joins up. On my next slide, you'll see how I really believe that what matters to you all joins up. Now, before I sign off, I'm conscious that I told you something quite personal about my daughter earlier and what mattered to me when I was working in the supermarket. And I'm delighted to say that after many months of not leaving the house with lots of support, she's doing extremely well. And she now happily leaves the house every day for school, which is something that really matters to her because she loves school. And she even came in one day, not so long ago, bursting into the room, telling me she'd got into the top set for maths. So we're really pleased about that. So I'd really like to say a huge thank you to the charity for giving me, someone you'd never heard of, the opportunity to attend a conference where I learned about what matters. I've been given the privilege now of speaking alongside Maureen and the other leaders in the field because of the work done here at the Royal Free. And much of the work I'm presenting would not have been possible without the support of the Royal Free charity the amazing leadership of the Royal Free Exec teams, and the dedication and passion of so many Royal Free staff and volunteers. So as I close, I'd like to thank the people I've met along the way: Ali, Emma, Michael, Alicia, David, so many more patients, countless staff who've taught me that at the end of the day, all this comes back to a simple yet powerful conversation, had with kindness and acted upon with compassion. And let's offer the people the opportunity to talk about what really matters. We've learnt it's meaningful and impactful. And I know we've got a long way to go, but in some ways it's already starting to really transform how we give and receive our world-class care here at the Free. Thank you so much for listening, and I'll hand back to John.
Thanks, Karen. Absolutely wonderful presentation. Thank you very much indeed. I'll let people type their questions into the chat, but just while people are beginning, you talked about sometimes people might say to you, have we got time to do this? Now I am totally sold that this is clearly a really powerful methodology and absolutely in line with the way that the charity likes to approach finding solutions. But I guess for a lot of your colleagues, it feels quite new. They're under an awful lot of pressure. How do you sort of counter that concern from people that this is just another task on top of everything else they've already got to do?
Yeah, I mean, I have to say, I totally understand, and staff are overwhelmed and they do have so much to do. But let me just quickly tell you a story about someone who I worked with a few years ago, and she was a nurse at the hospice, and she said, Karen, I've just seen a patient here. Let's call him Jim. I've just seen Jim. And I spent an hour with Jim, and I asked him all the questions that I wanted to know about Jim, and all the things in my assessment. And she said to me, and then I thought, she's heard me talking about what matters to you and the conversation tool that we had, and she said, okay, I'm gonna ask Karen's questions. So she said, I asked your questions, and I was like, oh no, here we go. And she said, I had to spend another 40 minutes with him after I'd asked your questions, because what I found out about this gentleman had quite bad vascular issues, and he had head and neck cancer as well. And she said, what I found out was he was really, really nervous about surgery he was having tomorrow. And the questions that I'd asked him hadn't gleaned that. I didn't know that when I asked him when I had this conversation. And she also said that he said, and I don't know what to do because my toe has just fallen off in my shoe. And she said, I didn't know, and I hadn't given him the opportunity to tell me that this thing had happened to him. And it was only when I asked what mattered that I knew, and then we could have this conversation. I could talk to him about what happened. And she said, from that moment, she said, I'm convinced. And actually, if she'd have asked those things at the beginning, she would have met him where he was at, and he would have been able to say what really mattered to him, and it would have used her time more wisely. Now, I know that's one story out of hundreds, and I think sometimes it can take more time, but I think if we're not giving people the time to ask them what matters, then that's not great either. So it would. I mean, I think it could really revolutionise care if we all were asked what mattered. And I think when we go and see a healthcare professional, we want someone to meet us where we're at and ask us what matters to us as well.
Absolutely, absolutely. We've got a question from Judy, which is what matters to staff right now, and what's the most common answer to that question when you ask it?
Very, very good question. I've just been doing the staff debrief after COVID. So I'm knee deep in a lot of data from staff. What matters to them, what matters to staff at the moment is that they have rest spaces. That really, really matters. And I know at Barnet, they've got new rest spaces, and I know there are plans on the Royal Free site. That really, really matters to staff at the moment. And I think that really matters. What also matters is IT. So actually having the right IT infrastructure and being able to do their jobs and having things that make their jobs easier to do and not maybe more cumbersome. People really want also the flexible working. They really want that, they want to be supported to work flexibly and have some choice and autonomy. And what really massively matters is teamwork. It's come up. So teamwork and leadership have come up time and time again. And when we did the debriefs this time, we did debriefs. We designed a tool that was for debriefs within teams. We had over 60 teams in the Royal Free debrief as a team. We know that what really matters is that you feel part of a team, included, built up, cherished, looked after supported within a team, and then you have visible leadership around that as well. So they're the things that are coming up and that we're learning about.
Great.
But also doing a great job for patients as well. That's also what really matters. You know, if you can do a really good job and feel that patients get really good care, then that really matters.
And do you think that do you think as part of that experience that people are starting to understand asking that question itself improves patient care? Are people sensing that they're improving the patient experience every time they do that?
Yeah, I think so. And what I think is, if we also get used to asking each other what matters, we're going to get used to asking patients what matters, and the whole thing sort of all joins up, definitely.
Great. I've got a question from Anna. What do you think might be most surprising for the charity's donors about the work that we're helping to support around what matters to you?
I don't know. I'd have to ask you. I'd have to ask the donors. I don't know. I don't know whether it's surprising that we don't ask it regularly. I don't know if it's surprising that you guys funded this amazing supermarket. I don't know. I have just been really, my eyes have really been open to the possibilities of what we can do together as the charity and the Royal Free together, and the power of that, and the possibilities that could lead to. And so I'm excited to know what's going to happen next. I mean, I hadn't met anyone in the charity 18 months ago, and now I'm here, and I'm really excited to know what happens. Where we go from here.
And what potential do you think there is for this more generally across the NHS? So obviously you first encountered this at the conference that you talked about before. This has become quite a big part of the way we operate at the Royal Free. Is that true in other trusts, or are there opportunities for us to share what we've done and hopefully inspire others and help others to do the same?
Yeah, so we've started a small collaboration of other organisations that are really keen and looking at using what matters to you. Interestingly, quite a lot of people who are part of this collaboration have at some point been at the Royal Free. So we meet every once a month, and we've met 3 times now. And there's a small group of hospitals who are involved, who are working out and sharing ideas about how we can embed this. So yeah, we are working on there's a global What Matters to You movement that we're part of, but actually there's a much smaller local, kind of just slightly wider than London at the moment, but I think it will grow. I mean, it's growing every time we meet, of sharing ideas.
Fantastic. Now, if I can ask you what matters to you, I've got a question from Kate, who says, if you could have 3 things to really move this forward and power it up, what would they be?
3 things. The dream, I guess the dream for me is that every single patient or every single person in this organisation is asked every week, what matters to you? And that is fed in somewhere. So I really think if I could wave my magic wand, that patients would be asked on the wards or in clinics or in virtual clinics, what matters to you, and that we would be able to have so that they are asked, and that is fed into the multidisciplinary team. I think to be able to do that, we could do with some sort of infrastructure sort of training and we're in some discussion with the Sim Centre as well about how we can do that. And then I also think what we need to be really good is to embed those conversations with staff as well. So, and the staff have a place where they feel they can talk about what matters, and that we can feed it in to listen and do what matters as well, because that's the whole point of it as well. We're not just asking, it's listening and doing. But yeah, my dream is that all patients are asked once a week, and that's fed into the MDT, and that action is taken, that patients don't become, they're not patients, they become partners in their care and partners in their health. And I think and we change this power dynamic. That's something else I do. I change the power dynamic. Thanks, Kate. What we're thinking is, at the moment, that often the clinicians hold the power and what I would love to do is that we are equal footing. You've got patients who are experts in their own care, in their own lives, and in what matters to them. And you're meeting a clinician who has got expertise that they've learned it, but they haven't lived it. And how we can partner together and do what matters in that situation. I think that would be transformative.
That's a really exciting set of ideas. Lovely. Wow. Hopefully Kate and Caroline, I think, are both watching. So hopefully you've done an excellent pitch there. So you've talked about your journey with the other people that you've kind of brought along with you. How do you sell this to people if they've not heard about it at all? How do you kind of open the conversation? Because you know when you're in full flow, it's so obvious about your passion for it and your enthusiasm for it. But how do you begin the conversation with someone if you're starting from scratch?
Oh, okay. Well, I kind of feel in this organisation that we're 5 What Matters to You days now, and actually as an organisation we've really matured in the way that we're thinking and discussing what matters to you. So there will be how we did it sort of in the early days is that we challenged people to get involved in what matters to you, and actually there were certain people who weren't really sure about it but took up the challenge, usually because we had a competition and a box of chocolates that I was going to go and get from M&S as a prize. But they took up the challenge to ask. And I have to say, once somebody has asked somebody what matters to them and learned something new that they didn't know before, then there's a bit of a hook. We've just had our last What Matters to You day. And at the end, we had this amazing, 3 o'clock, we had this amazing group-wide meeting where anyone who'd been involved came together, and we talked about the story, not just really what we'd done and the sashes that we'd worn and the badges we'd given out, but the stories that we'd heard and the things that we'd done differently and the impact of that. And it was really, really powerful. It was really powerful stuff. And I've just sent an email to everyone on that, everyone who attended, and said, do you want to take this forward? We've probably got, I don't know, 100 What Matters to You champions now, people who are really passionate about this organisation. I feel we've reached a critical mass. And we're having a meeting next month, and we're gonna, how do we do this as a group? Because I think we've gone in the, we have so much good work going on in different areas, thinking about what matters, and so many people who, 2 years ago would never have heard of the question, have heard about it through What Matters to You Day or from someone else, have asked it, tried it, and now are using it and embedding it. But yeah, there will always be people who will hear something and take it and try it out. I remember when I first heard it, I thought, oh my gosh, I thought I was really quite good as a therapist. I thought I was quite good at patient-centered care. If you'd have asked me, I'd say, yeah, I don't need to ask what matters to you. I'd sort of do it in my normal physio assessment. But what I realized was that I was only picking out the things that mattered to me about the patient, whether how much they can move their arm or walk up the stairs, or, all those sorts of things. And asking, when I started asking what matters, I realized how seeing the patient as a whole person. And I realized, and I felt really like quite regretful of my years as a clinician before having not asked that question. So I think, once we start, how would I do it? I basically challenge someone. I say, go and ask, try it out. If you don't want to ask a patient, fine. Go home, ask your partner, your children, a friend, a relative, ask them what matters to them about something or what matters to them today. Create an environment where they can answer and be honest. And then you'll see the power of the question. And I think once people have seen the power of the question, then I think the possibilities are endless.
Great. We've had a question about the digital innovation that you were talking about. So obviously at the Trust and the charity, we're really excited about the opportunities to use tech and digital to expand exciting innovations like this. Can you just give us a bit more detail about where you think that might be going?
Well, it's really early days. It's really, really early days. So basically, I've commandeered someone from the digital innovation team who I met on his first day at the Free, and after 3 minutes, I basically hooked him in to what matters to you. So we are basically, he's a brilliant guy called Dave, who is working with us to think about how it could be a possibility. So we're really, really early days. And there's things that we're thinking about. We really need, we want the people to own their own information. We want it to be safe. We want someone, if someone says what matters, we need someone to be able to have read that information and be able to act on it. So you have to ask, listen, and do. So how does that work when would you see the information? How would you see it? So we're working on those sorts of things. We've teamed up with the renal team who are trialing it, and they're thinking the renal pathway, which would involve inpatients, outpatients, dialysis clinics, end-of-life care, and where it could work in all of that. And then we're submitting to the Digital Innovation Board, I think next month, to see whether people think it's a good idea or not. I mean, I obviously do. I know it's very, very complicated, and what we don't want is it to be an add-on for, as as you've said before, very busy clinicians for another thing to do. We don't want that, but imagine you're a clinician and you come in and someone walks in and you know something about them, you know what matters to them about that interaction. How much better, you're going to feel much better about that. It's going to increase your joy in work. And so I think there's huge potential, and it might not happen. We might need to design it this year, trial it next year. I think it's a bit longer term, but I've spoken to the head of patient experience today. He's really excited about it. So, it's something that I think we could develop, but I think it could be a game changer. I really do.
How exciting. How exciting. Yeah. Thank you. Well, I think what matters to some of our people watching is that we finish on time. So unfortunately, I'm not going to be able to take any more questions, but I'm sure after an hour of talking, you'd like to take a breather anyway. So thank you very much indeed. We've heard from Karen about the power of asking the right question and being receptive to the answer. And that's an example, I think, of how simple ideas can lead to massive change. We're really proud at the Royal Free Charity to have played a role in supporting Karen's professional journey by funding some of the training, which is just one of the ways that we support employees of the Royal Free London. If you want to help us support our hospitals and their staff, then details of how you can do that are on the screen now. It just leaves me to say an enormous thank you again to Karen. A huge thank you to my team who are working incredibly hard behind the scenes. This is the end of our current season of virtual talks, so I want to pay thanks to all of our speakers. If you haven't seen any of the previous talks, you can catch up with those on the YouTube channel. We'll be taking a short break over the summer. And then hopefully coming back in the autumn with more talks about how the Royal Free Charity and the Royal Free London work together to contribute to better patient care, better staff experience, and better research. You can tell us what matters to you. So if you have a suggestion for a talk in the future that you'd like to hear about, whether that's work that you've experienced directly yourself or just things that you know happen within the trust, you can tell us now in the Q&A box, or you can email us on info@royalfreecharity.org, and we genuinely would love to hear from you. If you've enjoyed our series, please don't forget that you can share those with friends and family, and you can watch them all again on the YouTube channel. Thank you very much indeed, everybody, and good night.